Rest your arm on a flat surface and look at where your elbow sits right now. If it is resting in your lap or hanging at your side, your blood pressure reading is already wrong before the cuff even inflates. That single positioning error adds between 10 and 20 points to your number. Here is what most people over 60 believe about home blood pressure monitoring. They believe that because they own a clinically validated monitor and follow the basic instructions in the box, their readings are accurate. The monitor itself is usually fine. The problem is that the instructions in the box cover perhaps 20% of what actually determines whether a reading is real. The other 80%, the positioning, the timing, the rest period, the cuff size, the measurement sequence, nobody explains. Not at the pharmacy, not at the doctor's office, and not in any leaflet that arrived with the device. In this video, I am going to walk you through the 4 specific errors that inflate most home blood pressure readings, how many points each one adds to your number based on published clinical data, and the correct 5-step method the American Heart Association recommends but almost never takes time to teach directly. The 4th error is the one that surprises people most, because it turns an accurate, expensive monitor into a completely unreliable device without changing a single setting. Subscribe to this channel before we go further. If your blood pressure management is being guided by readings that are consistently 10 to 20 points too high, you deserve to know that before you accept a medication change. Subscribe, and let's correct the numbers. You know exactly how this routine goes. You wake up in the morning, sit down before breakfast, wrap the cuff around your arm, and wait for the numbers. When the reading is high, you feel that familiar drop in your stomach, the quiet worry that follows you into the next hour about whether the medication is still working or whether a stronger dose is coming. When it reads lower, you feel briefly relieved, then uncertain about whether today's number means anything or whether it is just an outlier you cannot explain. You bring a printed log to your next appointment, and your doctor reviews it and adjusts the prescription accordingly, and at no point in that entire exchange does anyone ask how the readings were actually taken. Nobody asks whether you sat for 5 minutes beforehand, whether your arm was supported, whether anyone was speaking in the room. The treatment plan is built on data that has never been confirmed as accurate, and neither of you knows it. Here is the conversation that almost never takes place at a standard appointment. The technique required for an accurate blood pressure reading is specific enough that the American Heart Association publishes an entire clinical statement dedicated to it, and most patients have never seen a single word of that guidance. In most offices, the patient sits down, the cuff goes on within seconds, intake questions are answered while the reading is being taken, and that number enters the chart as a definitive measurement. Nobody explains that talking during measurement adds an average of 7 millimeters of mercury to a systolic reading. There was no time in a 12-minute appointment for the explanation that would have changed how you measure at home, and there is no billing code that reimburses for teaching correct technique. So the error continues every morning, invisibly, into every decision made about your care. Before the errors, 2 situations require a doctor today, not after watching this video. If your home readings are consistently above 180 systolic or 120 diastolic, regardless of how they were taken, that is a hypertensive crisis range and you need evaluation today, not tomorrow. If you experience a sudden severe headache, changes in your vision, chest pain, difficulty breathing, or confusion alongside a high reading, call for help immediately. Do not adjust your technique first. If your doctor recently changed your medication and your readings have been unusually low or unusually high since, contact them before making any other changes. For everyone else, what follows explains why your current readings are almost certainly not reflecting your real blood pressure. Here is the error most people never suspect, and I am leading with it because it changes how you will think about every reading from this point forward. The first reading is almost always wrong. Your second reading is your real number. When a blood pressure cuff inflates, your body's vascular system reacts. The vessels tighten briefly in response to the sudden external pressure, then relax back to their resting state over the following minute. This initial vascular reaction adds measurable false elevation to the first reading. The American Heart Association guidelines specifically recommend waiting a full minute between readings and recording the second, or the average of 2 readings, precisely because of this response. Research published in Hypertension found that the first reading averages 4 to 6 millimeters of mercury higher than the second, taken from the same person under identical conditions. Most people take one reading, see the number, and carry that figure into every decision they make that day. Your first reading is your vessels flinching. Your second is their honest answer. The second error is the one most people are making every single time they measure, and it is also the simplest to correct. Your arm must be resting on a flat surface with your elbow at approximately the height of your mid-chest at heart level. Most people rest their arm in their lap, hold it extended to the side, or let it hang while the cuff inflates. The reason this matters is basic physics. Blood pressure is measured as the force blood exerts against vessel walls, and that force is influenced by gravity. Every inch your arm sits below the level of your heart, gravity adds approximately 2 millimeters of mercury to your reading. If your arm is resting in your lap and your elbow sits 6 inches below your heart, you are beginning with an error of roughly 12 points before measurement even starts. A study published in Blood Pressure Monitoring confirmed this relationship and identified incorrect arm position as one of the most consistent and widespread sources of error in home blood pressure monitoring among older adults. The third error is actually 2 errors that almost always occur together, and each one adds significant false elevation independently of the other. The first is inadequate rest before measuring. Walking to the bathroom, making breakfast, climbing a flight of stairs, even the physical act of settling into a chair raises blood pressure temporarily. The American Heart Association guideline is 5 full minutes of seated, quiet rest before the cuff inflates. Most people measure within 1 to 2 minutes of sitting down. A review published in the Journal of Clinical Hypertension found that insufficient pre-measurement rest accounts for an average of 5 to 10 points of false systolic elevation in home readings. The second error is talking. If you speak to someone in the room, respond to the television, or even ask a question while the cuff is inflating or deflating, your reading rises. Research in blood pressure. Monitoring found that conversation during measurement raised systolic blood pressure by an average of 7 millimeters of mercury. 5 full minutes of quiet, then measure. Those 2 changes together can lower a reading by more than most medication adjustments. The fourth error is the one that surprises people most, and it is the one that makes even a properly positioned, properly rested, properly sequenced reading completely meaningless. Cuff size. Every blood pressure cuff is designed to compress a specific range of arm circumference accurately. If the cuff is too small for the arm it is wrapping around, it cannot adequately compress the artery and compensates by registering artificially high pressure. Think of it like trying to squeeze a thick pipe with a clip designed for a narrow one. The clip cannot do its job, so the reading reflects the clip's struggle rather than the pipe's contents. Research published in the Journal of Human Hypertension found that using a cuff one size too small inflates a systolic reading by 10 to 40 millimeters of mercury, not a minor rounding error. 10 to 40 full points on a single measurement. Most home monitors are sold with a standard cuff designed for arm circumferences between 22 and 32 centimeters. A significant proportion of adults over 60, particularly those who carry any weight in the upper arm, fall above this range and require a large cuff. If you have never measured the circumference of your upper arm and compared it to the size range printed on your cuff, you have no way of knowing whether every reading you have taken in the past year reflects your blood pressure or your cuff's limitations. Let me tell you about someone I will call Frank. Frank is 70 years old, a retired postal worker from Ohio who had been managing high blood pressure for 6 years. He measured every morning before breakfast, kept a careful handwritten log, and brought printed records to every appointment without fail. His home readings were consistently between 148 and 155 over 88 to 94, numbers that had led his doctor to add a second blood pressure medication 14 months earlier. Frank was not obviously doing anything wrong. He owned a reputable monitor. He measured at the same time each morning. What he had never been shown was how. He measured sitting on the edge of his bed, arm resting in his lap, cuff inflating within 2 minutes of waking up, with the morning news playing in the background. 4 errors running simultaneously, in the same direction, every single morning. When his son came across information about the correct measurement technique and showed him, Frank corrected all 4 errors the following morning. His reading was 131/79. Not because his blood pressure had changed overnight, because for the first time in 6 years, he was measuring it correctly. His doctor reviewed the new readings alongside in-office measurements taken under properly controlled conditions and began a conversation about whether the second medication added 14 months ago was still appropriate. The numbers that his treatment had been built on for over a year were not his numbers. Here is the correct method. 5 steps in this exact order every time you measure. In the morning, before breakfast, and before any medication, begin by emptying your bladder. A full bladder raises blood pressure by 10 to 15 millimeters of mercury, the equivalent of a stage 1 hypertension reading, and this step is almost never mentioned in any instruction booklet. Then sit in a straight-backed chair, not the edge of the bed and not the couch. Back fully supported, feet flat on the floor, legs uncrossed. Crossed legs restrict venous return from the lower body and add 2 to 8 points to your systolic reading. Set a timer for 5 minutes. During those 5 minutes, do not speak, do not check your phone, and do not watch anything that provokes a stress response. Let your cardiovascular system reach its genuine resting state. This is the step most people skip, and the one that changes readings more than almost any other. Position the cuff on bare skin, never over clothing. The lower edge of the cuff sits 1 inch above the crook of your elbow. Rest your forearm on a flat surface, table, desk, or armrest at desk height, so your elbow is level with your mid-chest. This is the heart-level position. Take 2 readings, 1 minute apart, without speaking between them. Record both numbers. Use the second reading, or the average of the 2, as your measurement. Discard the first reading entirely. Repeat this in the evening before dinner and before any evening medication. The morning reading captures your baseline before the day's activity. The evening reading shows how the day has affected it. Together, they give your doctor a complete picture that a single office measurement never can. You will notice within 1 week that your recorded numbers are lower and more consistent than anything you have tracked before. That consistency is the confirmation that you are finally measuring correctly. Here are your 5 steps. 1. Measure your upper arm circumference tonight using a soft measuring tape and confirm it falls within the stated range printed on your cuff. 2. Move your blood pressure monitor tonight to a location with a straight-backed chair and a flat surface at chest height. 3. Take 2 readings tomorrow morning using the correct method, 1 minute apart, and record both, discarding the first. 4. Set a 5-minute timer before every future measurement and stay seated and silent for the entire duration. 5. Bring 2 weeks of corrected readings to your next appointment and let your doctor see what your blood pressure actually is. 2 things before you go. First, how old are you? Write your age in the comments right now. The age of this audience shapes which blood pressure, cardiovascular, and medication topics this channel covers next, because what matters most at 63 is different from what matters most at 76. Second, where are you watching from? City, state, country, leave it below. And if someone you know is making medication decisions based on home blood pressure readings, send them this video. The numbers guiding their care may never have been measured correctly.